All right. Good morning. Good morning. Happy Wednesday. It's hump day. I see everybody trickling into the meeting. I'll give you all a moment. I'd like to introduce myself. My name is Michael Kaplan. I'm the head of recruiting here at Global Premier Benefits. I'm going to be behind the scenes today, mostly answering questions in the chat line, letting people into the meeting, that sort of thing. I would like to lay the ground rules, though, as you all have probably been on 1,001 Zoom meetings since the pandemic started. But we're taking notes today. We're definitely going to mute yourselves, or I'll take care of that. The last thing we want is, like, for example, I have a 1-year-old baby. I don't want to hear her crying in the background, and neither do you. So let's mute ourselves and unmute ourselves at the appropriate times. I would say use the chat line down below if you do have a question that pops up. That way, when there's a Q&A session, we're not going to forget the question. But then also have fun. This should be a good session. We've got a lot of entertaining speakers today, I'll say that. Essence Healthcare is going to blow you away with what they have to share, I promise you. And with that said, I'm going to pass the mic over to our managing partner at Integrity, Mr. Tony Holland. Tony, are you there?
Hey, I'm excited.
Yeah.
I've been looking forward to this meeting for the last 2 weeks, man. I'm really excited.
Me too.
Man, I'm excited. So, I mean, it just shocked me when I heard about this opportunity with Essence Health from one of our other partners. And he's like, "Do you ever hear of this company?" And he said, "Essence Health." I'm like, "Essence? That was an African-American magazine back in the day, or still is today." And I have never heard of a company called Essence Health. So I redid my research and found out we have an exclusive partnership arrangement with them. So I'm just so excited about what they got to share today. And when I learned about their rating with U.S. News and World Reports, I think it's in Missouri as well as in Illinois, rated best Medicare Advantage insurance company. That was exciting. I'm like, how come I've never heard of this company? They've been around, what, 20 years? 20 years, Michael. And never heard of them. Why? Because they were typically a captive shop until, just recently. So that's why a lot of us that are on the broker side and the IMO side have never heard of them, but I'm really excited about what they have to offer with their 5-star plans, what they're doing in their marketplace for their clients and how they're expanding. There's a lot of great stuff that's happening with them. And I'm not going to steal their thunder, but we have two young ladies on the call today. They're going to get you guys up to speed and why Essence Health should be your carrier of choice. Michael, you can go to the next slide for me, please, big guy. So we have Nikki Leone. She's the Director of External Growth with Essence Health. Nikki, are you there?
I am here.
Play that song, Michael. What is that song? I want to hear it.
How are you guys doing? I'm so
All right, I got to guess the
excited for
song.
this.
I feel like I'm going to name that tune. What song is that, Michael?
This is a surprising pick. This is going to be a duet, surprisingly. That's actually Tom Petty and Stevie Nicks. That's a deep cut. That's a deep
love
cut.
Tom Petty and Stevie Nicks. That's great. That's awesome. So just so you guys know, we have fun in our organization. Michael, by the way, his initials are MC. I do believe he was a former Motown DJ back in the day, or MC. So I have no doubt in a former life he was spinning some records back in the 50s and 60s.
You might be right about that.
I love it. Tony, are you sharing the presentation? I just want to make sure I'm able to see your screen okay.
Well, Jen, you can, or Nikki, you can share your screen. Actually, why don't I do that? I'll stop sharing now. You can start sharing those slides.
Sounds good. All right, can everybody see it?
Yep, fire away.
Right.
So, ma'am, why don't you introduce yourself first? I know we scheduled it with Nikki. I know Nikki is on as well, but I'll make sure the team knows who you are.
Sure. Good morning, everybody. Really glad to be here. Thank you for having us. We really look forward to working with you. My name is Jennifer Dixon. I am the Director of Field Sales with Essence Healthcare, responsible for the Missouri and Illinois market. So really looking forward to sharing our plans with you today. And then, Nikki, do you want to get started? And then...
Nikki, you're muted. If not, Jen, can you take over?
Yep, sure. So again, good morning, everyone. We're really glad to be here with you today. Going to talk to you oh, go ahead, Nikki. Can you hear?
I can.
All right. Do you want to take it? Take the start?
I will while I have the connection. I apologize for the internet issues. I'm so sorry. I have been looking for forward to this meeting for a long time. I see Ken, Lee, Mike, Carrie. Thank you guys so much for joining. I understand it's a very exciting time of year. But with that being said, there's still a lot of time left. So we want to introduce you to the Essence plans. I have Jen Dixon here. She's the director of Missouri sales, and Jen's a great contact to know. She's been with the company for over 10 years, and she can really help dive down into the details once you guys are interested in learning more, and answer some Q&A for you guys. But let's get started, and I'll give you guys an introduction on who Essence Healthcare is for those of you who don't know. So as we look on to the next slide, we're going to really try and give you some key points to understand who we are. We are a 5-star rated plan. We have been for the last 3 years, and we have a long experience with 4.5 to 5-star ratings since as long as we've been doing Medicare Advantage. So that's who we're known for. We've been in the Missouri area, and we are expanding. So that's why a lot of you are new to hearing Essence Healthcare. We've been in Missouri. We have Jen, 60,000, 65,000 members. 90% of them are on our 5-star plans. Our retention is amazing. We have local customer service and producer support. So not only are we really passionate about making sure that our members are taken care of, but we also want to take care of our agency partners, which includes Holland Insurance and you guys. So those are just a couple key differentiators as you start learning more about our plans. We can look forward a little bit, and this is just a quick pat on our shoulder, just to give our Net Promoter Score. So Net Promoter Score is how you would rank a plan or any other product in the industry. The average is about, I don't know, anything over 1 is considered good. And Essence Healthcare's Net Promoter Score is 43. And you can also see our voluntary disenrollment rate is significantly less than the industry average. So when your members come on with us, they love it, they stay, makes your lives easy. We pay fair market value each and every year, the maximum allowable that we can. And so that's really good to know when you start adding members to your book of business. Next slide, please. All right, so here's something for us to think about too as we start looking into the industry. You know, there's a lot of acquisition taking place. So there's a lot of hospitals buying pharmacies and pharmacies buying some retail locations. We don't have any owned relationships. So when you're placing your business with Essence Healthcare, you know that we're advocating directly for your members. And so that's a good feeling. Let's look a little bit further here before we walk into the value props and our benefit design. So resource sharing. So Tony mentioned earlier that we're switching our distribution from a captive model to a broker model, which means we have a lot of really cool opportunities for you guys. That means leveraging our hospital relationships, our key anchor partners. It means sharing some potential leads, co-ops, accessibility in our retail locations. And so really being an extended captive with our organization. And I think that's something that a lot of agents look for, right? We look for key opportunities where we kind of eliminate the other competition in the broker industry. And this is one of those times where you can get in at the ground floor as a captive broker partner or a close broker partner. However close you want to work with Essence Healthcare, we're here and ready to support you. Next slide. So here I'm going to kick it over to Jen because Jen does a really good job in understanding where we've came from a benefit design. And she really does acknowledge the key differences that we have in the marketplace and understanding, you know, where you're going to be hearing questions from your existing book of business when your members eventually hear about Essence Healthcare. So Jen, I'm going to kick it over to you. Again, Jen is the director of Missouri Medicare sales. Jen.
Thanks so much, Nikki. So I know I heard you say in the beginning that, Essence, we've never heard of Essence. And so I just want to, set the stage of some things to think about. We have grown to be the second largest MA plan and HMO lives in our areas. And we've done that for a reason. And our number one reason that a lot of agents will write us is because of our formulary. As Nikki said, I've been with Essence for 10 years. I started in sales with Essence. And at that time, we had a really narrow network. We were built by physicians and we really, held tight on our model of narrow network value-based care. And we really set ourselves, and that's really changed over the years. We have almost every doctor and hospital in our area. But what has remained in the plan is our dedication to our formulary. People will come with us. They'll stay with us. Agents will write members to our plan because of our formulary. Back in the day, I would have people that would switch all their doctors up just to come to us because of our formulary. So we're known as having a really broad formulary. We have medicines tiered at a tier 1 and tier 2 that may be tier 3s and tier 4s with other carriers. Our pricing is very stable. So, we don't do a lot of changing from year to year. So that really drives retention. We also have in our HMO plans a program where we offer insulins for $0 prior to the coverage gap, which is unique in the marketplace. MOOP, we have really there's a lot of good competition in our area in Missouri because, we take some credit for that because we've driven down the MOOP in the marketplace. We're known as having plans with low maximum out of pocket, and we have a plan in St. Louis with a maximum out of pocket as low as $1,900, which is, really unheard of. We, again, as Nikki said, we're known for our customer service. When we survey our agents, after the AEP, two of the main reasons that they write us is your formulary and your customer service. People will literally come to our plan because our customer service is that good. So that's our customer service for our members. And then, as Nikki said, our producer support for you, for our agents, also really prides themselves on providing a top tier white glove service. We've got that 5-star rating for a reason. And commission payments. We, as a local plan, right? We've always in the marketplace offered top level contracts because, Essence Healthcare, it may not be that known brand, but, we want to incentivize our agents financially to write us and keep their members on the plan. So we've got maximum allowable commissions, best in class contracts. And with that, that's sort of setting the stage for Essence. And 2024 for us is a game changer. We are making significant or have made significant investments. So, when we went around and did our, pre-AEP rollouts, we used the term meds, MOOPs, and molars. So, we would ask the agents, why are you going to sell us in 2024? And it's meds, MOOP, and molars. Well, meds, we've already talked about meds, right? We're market leading formulary, $0 generics, including in the coverage gap. We talked about MOOP and molars. So traditionally, agents have written us because of our meds and our MOOP, right? We've had dental, but they haven't come to us because of dental. This year, we are breaking all of our own rules and changing that. So this year is our year of the tooth, where we have rich dental benefits up to $7,000, which if you can tell me you've heard of a plan that's not a D-SNP that doesn't have that has $7,000 in benefits, I would be surprised. So we have a PPO plan with $7,000 in benefits, flex card allowances, and we're also allowing out-of-network use and dentists on our PPO plans. So when we look at our plans, our PPO plans, again, not D-SNP, just regular PPO plans, have allowances of either $5,000 or $7,000 of comprehensive dental benefits available on day one. Those are PPO plans. So that means Our member can go in network, their money will go a little farther, but if they want to go out of network, they can get their $5,000 or $7,000 and choose their own dentist. If the dentist will bill, fine. If the dentist, doesn't like insurance and doesn't want to mess with a plan, that person can pay and get reimbursed. So we're going to make it really easy for that member to be able to access that dental care. And as well as I do, that people are making plan decisions now based on that dental. We removed any prior authorization. So as long as it's a covered code, it's going to be covered. And again, first dollar, January 1, if somebody has an implant, they can have up to $7,000 in coverage toward that. So a few other things that we've done is, flex cards. We've made significant improvements from 2023 to 2024 in our flex cards, which means that every Essence member, doesn't matter the plan, and we have many plans to choose from, but it doesn't matter the plan, they will get a flex card once they enroll. They'll get an amount quarterly that will roll over from quarter to quarter, and they can use that at Walmart or Walgreens for their OTC. They can also use that toward their dental, vision, and hearing. Again, flex card applied quarterly, and it will roll over OTC, dental, vision, and hearing. Another thing that's really special and unique about Essence is we listen to our agents and our partners. And a lot of the changes that we make from year to year are really based on the feedback that we hear. And this next one is one of that. We heard from agents, hey, you guys have co-insurances on your diagnostic services. So guess what? Now we've got flat copays. It makes things a little bit easier. People know what to expect. We've talked a lot about our pharmacy, where we've got the $0 generics, and that extends to the coverage gap this year, and again have rich vision benefits. So when we look at our product highlights, we've gone really aggressive with PPOs. People want flexibility. They want to be able to see a doctor if they're, they want to be able to know that if they're traveling that they can see a doctor, which of course they can get emergency care, but we've got 6 highly competitive PPO plans in all of our market, and standard, every market that we're in, we've got that $5,000 dental benefit. We've got lower MOOPs, PPO MOOPs, really affordable, $3,000 or $3,400 in St. Louis, affordable hospital copays, affordable PCP and specialist copays. And one thing that's really exciting about our PPO plans that we're not seeing with a lot of other PPOs is that many of our out-of-network services are the same copay as in-network, with the exception of, primary care and a couple of other things. So specialists, in or out, same copay. Hospital, in or out, same copay and the same affordable maximum out-of-pocket. We're expanding counties. So in our, what we call our St. Louis, Missouri market, that's really where we have the bulk of our membership in Missouri and Illinois. We added 7 new counties. So again, continually making investments in our benefits and our areas and our partnership. We've added new counties in our Southwest Missouri market. That's the Springfield area. In Cincinnati, which includes Ohio, Kentucky, and Indiana. 8 new counties, and 14 new counties in Louisville, Lexington, and the Kentucky area. And that's another area where we're really seeing a lot of opportunity there. So, and when you see the areas that we're in, so we are in the Little Rock, Arkansas area, and then you'll see the counties here. So that is 6 counties. In the Little Rock area, we have an HMO plan and a PPO plan. Again, every market is going to have that standard of $5,000 in comprehensive dental on that PPO. And that's really, as we're, into a few weeks into the AEP, that's where we're seeing the bulk of our membership coming in as our PPO plans. And then our Cincinnati market, which does extend to Ohio, Kentucky, and Indiana. And then our Louisville, Lexington area, which has 14 new counties. And again, that HMO and the PPO plan. Our Southwest Missouri market, which is a different plan. Southwest Missouri is very exciting because we've got a PPO with a MOOP under $3,000. And then is what we would call our St. Louis plan, but it's really parts of Missouri and Illinois. And in this market, we've got 5 plans, but really 2 core HMOs. One's known as having a low maximum out of pocket. And then 2 PPO plans. The PPOs were new this year. And again, most of our HMO plans, another opportunity is that, as Nikki mentioned earlier, 5-star rated HMO plans. So there is opportunity now, and there's going to be opportunity all year long to write with us with the 5-star. And then here's some of our key provider partners. This is not everything, but just a high level overview of some of the major providers that we're working with. And then here we've got a QR code for you so that you can scan, get a copy of our benefits and some resources as well. And when everybody's got that, let me know. So again, lots of good stuff going on with Essence, good contracts, 5-star ratings, really, really incredible PPO benefits with the 5,000 to 7,000 in dental. And we are looking forward to working with you.
Awesome stuff. Thank you so much. Appreciate the shuffling of presentation skills. That was awesome. We got the dynamic duo here. That's great. So there are a handful of questions in the chat. I just want to jump over to that and get my screen back set up here. So let's see. And I answered 1 or 2 of them at the beginning. Just to clarify, I just want to make sure that we're all on, all on the same page. Are there any plans approved in Wisconsin as of right now?
No.
Not at this time.
Got it. Thank you. Sorry, had to.
Michael, will this call be recorded? We can look at it again.
Of course it will be. Yes, absolutely. All of what we do is recorded, and I'll be able to send that out to you guys after the fact, including a link to get contracted as well.
Yep. Let me pull up the QR code again for everybody if they didn't get that. There you go. That will have all the areas, all the benefits in each area.
So is there a link to Essence First Look for 2024 that we can you can put in the chat window?
I'm actually going to send that out to you guys afterwards. Matter of fact. Yep. So I'll send you an email with the recording of today's session. I'll send you an email with the first look slides and then some contact material in case you need to reach out to them for anything. So yeah, you should be well taken care of, but a little later today. I think as we all know, Zoom recordings aren't as snappy as I'd like them to be, but they'll be available later this afternoon. Let's see. Actually, there's a handful of other questions. Georgia, Texas, Florida, California. Geez, that's quite a few. So Georgia, Texas, Florida, California. Any of those on the horizon for Essence Healthcare?
Ooh, on the horizon is a good question. I think there's a lot of opportunities for 2025 and beyond. I think we would probably stay a little bit more centralized to our existing service areas, but we are currently not in any of those states.
Excellent. Thank you very much. Let's see where QR code again. Check. Got that. And then appointment time and contracting. What's the turnaround look like that? I know it's been very quick so far. Well, what's that look like?
Awesome. Yeah. So if you just send us your national producer number, email, and name, we would process your onboarding request same day.
You said same day?
I did, yes.
Oh, wow. All right, cool. Look at that. That's awesome. As a matter of
And
fact,
it's already loaded Insurance Bay right now for those people who want to get contracted. If you go to Insurance Bay through Global, you'll be able to get it.
So, Michael, why don't you? That's a perfect question to lead in what you're going to cover to get people up and going. So, before you do, go ahead, Michael. I'll let you.
No worries, Tony. We do a lot of, carrier presentations and rollouts and first looks and things of that nature. And the questions I always get kind of are the same from presentation to presentation. How do I get contracted? Is this recorded? The same questions we got today. So yes, we will send you a link to get contracted, and it's a very quick turnaround as we were just describing. And then if you need the first look and all of that, it should be all in the same email. I'm typing that up as we speak, and you should receive that in your inbox later today.
Great stuff.
Thank you.
Can I add one thing? So for those of you with a particular interest in the Missouri market, we have our very last benefit training session Friday morning this week at 9 Central. So if you want, I can post the Zoom link in the chat, and it'll really be more of a deep dive into the benefits and plans that we have available in Missouri. So if you're good with that, I can post that in the chat, and just pop on if you'd like to join. And that's Friday at 9 a.m. Central.
Yeah,
wonderful.
Post it.
Okay.
Thank you. That actually goes right along with the next question. So you're in these states, Ohio and Illinois and stuff. I know there are specific counties. We sort of touched on that earlier, and the first look will go a little deeper in that. Is there maybe a product map perhaps, or a link to a marketing aid or something like that? Or is that part of the first look?
Yeah, it's all there in that QR code. Everything that you need is in there. Every
Perfect.
plan, every area, it should be pretty comprehensive.
Fantastic. That's great. Thank you very much, ladies. This was great. I'll give everybody just a final moment here if there's any other questions that come through. Tony and I are going to wrap up with a couple of announcements after the fact. I'll give you guys an extra second here to type something in the chat.
So my last question, Michael, is once we get contracted, it will be officially loaded into our Medicare Center link, our back office, so we can do online enrollments from there, correct?
That's the plan. Yep. I know since Essence is new to us, there may be a minor delay on that side. But yeah, the idea is that it'll be loaded in there along with your other carriers.
And Michael, you did say that you will be sending out the first look URL after this meeting with all of the plan information, correct?
Correct. Yep.
Okay. Takesha, I think that answers your question on that chat.
Fantastic.
Great
Very
stuff.
good.
Thank you, guys. Super stuff from Essence Health. Really excited. Hey, guys, we hang on the line. We got a second part of this, part two, so you guys could understand who we are, how our partnership is working with Essence. Just so you know, we're really thrilled about this company. And that's why I wanted to have this special meeting today. I know we're in the middle of AEP, and I want to appreciate each and every one of you guys taking time out today to learn about Essence and also learn about what makes us special. As you guys know, I'm the managing partner with Integrity Marketing Group. Been in that role for it'll be my 2-year anniversary in next month. And Michael and I have some really cool, unique things to share with you guys. I know most of you guys in this call are already with us in some type of way, but I know there's some newbies on this call that you might want to know. What makes Global and Integrity special? What makes us unique? And by the way, not every Integrity partner is the same. Yes, we have similar tools and support services, but Global has definitely been a shining light in a challenging market. One thing, we're very hands-on. We interact with our people. I mean, people are shocked that they can talk to the IMO directly, which is me. So that's one thing we wanted to share. We're headquartered. Our main office is in Dallas, Texas. That's actually the building that we're in. And our local offices, we have many of them across the country. Michael, won't you go ahead and share the next slide so we can get to the meat of this meeting? So a lot of agents call me all the time. As you guys know, I'm big on social media now, and I get a lot of calls from, other organizations out there about, making their life easier. This can be challenging, and we got some incredible tools. I'd like Michael to, take the mic back. How we're going to make your job easier. I know we all know what we do. And one thing I love about this business, we get to change and save people's lives every single day. That's kind of the summary of our mission statement. Get them better benefits, save them money, but ultimately we want to change lives and save lives. That's why God put us in this position and what we do. This is no accident. There's people out there by the millions that need your help. They need good agents. I mean, you guys have been doing Medicare Advantage as long as I have. Been doing it since 2008. There's been a lot of challenges with this. And these regs that have come in, I think is a good thing because it weeds out the garbage that's in this business, like those old J.J. Walker and Joe Namath commercials. I mean, you guys have probably run across them over the last few years. I thank God they finally put an end to that nonsense. And of course, we've had to come out with, new regs. I actually welcome those regs. Those regs, as I said, kick out the people who shouldn't be in this business to begin with because they've muddied the water for the rest of us that are trying to do it for the right reason. And that's what I want to make sure as you join our organization, we're going to do what's right or we're not going to do it at all. But our goal as an IMO and as Integrity's goal, and my goal is to help you do what you love to do easier. I know we all on this call, we love helping our seniors, making a difference in their lives, seeing that smile on their face, getting that hug for them, and sharing coffee and sharing, reminiscing with them. And I mean, for us at Global, our clients are like our family. It's more than just a business. It's more than just making a commission. It's more than just making money. These are people's parents and grandparents that really need a good quality and honest agent with integrity to help them through this maze of Medicare. So how do we make your job easier? Michael, you ready to put it on them?
Yeah, it's largely on the tech side, Tony. This business gets more complicated, but it can also become simpler if you know what you're doing. And that's what leads me into this first piece is Medicare Center. Medicare Center is Integrity's free web-based CRM system. So anywhere you have an internet connection, you've got a CRM system that can be as comprehensive as you want it to be, including call recordings and quoting and enrollment all in one. Now, there's also an app, basically, so you don't need to be plugged into the computer, hardwired into the internet. You can be on your phone, on the go, in between appointments, and do all of the same functionality, which also marries right into Lead Center. Everybody needs leads in this business. Doesn't matter how effective of a salesperson you are, how knowledgeable you become, and how great of a resource if you have no one to talk to. Lead Center is the all-inclusive hub for leads that ties right into Medicare Center and all the notes that you enter. Plan Enroll. You may be familiar with this, Tony. I think it used to be called Medicare Enroll, yes. But Plan Enroll is sort of the rebranded, since they became part of Integrity's umbrella. Basically, Plan Enroll is marketing on your behalf. So if you're using these platforms, Integrity is going to market you and your agency and your business to the beneficiaries and senior community. I just said on this morning's call, I got a call from a beneficiary. I'm not even an agent. I have a license. They're marketing my license and they're driving business towards me. But I just think that's funny. If you're using the platforms, they're going to market on your own behalf. So it's like a free lead resource, which is tremendous. And then,
so Mike, before you get into that, my friend, I can't stress enough how important technology is today. When I got in the business, we had to carry those books around. We had to use ADC maps to get to our appointments. All our tools are designed with the latest in technology, has GPS systems built in for those field agents. Michael mentioned a mobile app. I mean, we have every quoting tool possible you need, from CSG, Blue Point, you name it. We have them all built into the system, and all the carriers are also built in that system. So you can do, plan comparison with your client right on the spot, whether you're in the field or on the phone. Everything's done, telephonically if you need be. And we have ancillary products that are built into the model. It's pretty impressive for that agent out there. Whatever tech tool you need is built in the system. And if anything comes out new, we're usually on the forefront of that, making that happen. We got a new tool that's coming out soon that'll actually be able to tell your clients when they're ready to switch their Medicare plan. So it even tells them after they switch. Let's say you got a client, Michael, it's pretty cool, that you just enrolled in, say, September 1 effective. And some other agent gets to them, let's say, November 1, okay? And they're ready to write new plan. It'll tell you that they have a January 1 effective before they leave you. Isn't that pretty cool? Before they even leave you, you'll get alerted to say, hey, Miss Betty Smith just enrolled in XYZ plan. She's looking to leave you. You have until now, November, until January 1 to save your client. Isn't that pretty cool? Because you know the CMS rules, once they switched away from you and you're no longer the agent of record, legally, you can't contact them. So while you have that 30 to 60 day grace period, because they're not going to call you and tell you they left. Many of them don't even know they're being moved. You wouldn't believe how many seniors out there are being moved into plans and they don't even know they're being moved. So that way, not only you protect your book of business, but you protect your client. Isn't that pretty neat, Michael?
That leads me right into my next bullet point of ask integrity. So integrity has become so ingrained in the business. They've gotten so large and their reach has gotten so far that we've actually developed our own artificial intelligence to implement into all these tools. I'm not going to sit here and pretend that I created it or that I even know more about it than I do. But the fact is, the information in the system can be put together and presented to you in a way that you can become more efficient at doing your job, and you can retain a greater book of business year over year. And that's a huge difference maker. And that's just what it does today. Imagine next AEP, 2 AEPs from now, imagine how powerful and useful that tool is going to be. And it's relatively simple to use. You just need to know what you're asking for. If you just say, give me everybody that's on a plan, that's not going to work. But if you say, what was the last time that I saw Betty Johnson, or what's her doctor's name, it can tell you that. As long as it's in the system, it can tell you that. That's
so
huge.
Michael, on that note too, it's like your own personal assistant in your ear. We've been working on this project for well over a year now with our call center agents with integrity. Over 3,000 agents have proofed this. And it's so cool to see it in action. I've seen it live at the office where it's actually speaking to the agent to give advice, give them tips, to help coach them through the process. Because not every, I mean, when you're an agent, it's hard to get to the data that you need, especially if you're working in multiple markets. The Ask Integrity kind of robot that's in your ear can tell you, hey, this plan is available in this market, and these are the 4 best plans that you can show your client while you're on the phone with the client. So it's really, really cool that it'll help map out your appointments, help actually do with your commission statements, because you get 5 or 6 different commission statements. It's a pretty robust tool that I want to stress. I've never seen anything like it. It's your very own AI robot that's helping you do this business. I mean, it does everything but enroll the client for you. Like for extra help rules, that rule changed just past year, the new extra help. The robot already knows that and can tell you the updates while you're working with your client. There's SPAP programs out there in specific states like Maryland and Delaware and PA. You may not know all those specifics, but the AI robot will. That way it'll help you service your client in real time to give you the answers your clients need, so you don't have to hang up the client, make a phone call, and call them back in hours. Has the real-time information you need. Another quick point, Michael, you left out about the silver sneaker lead. My God, that lead is pretty.
Haven't gotten there yet.
Whoa! I'm sorry. I'm giving back. I'm feeling your thunder, brother.
Tony, you can roll out the red carpet, but don't go walking on it.
Okay,
right?
Well, go ahead. Yeah, I got my brand new Crocs on to do that though. So
God, you really are living in Florida. I feel like. Hey,
a lot of crocodiles down here. And
you said it does everything but enroll them for you. Matter of fact, I can't say it does it for you, but they do make a pearl for every person. So if you're on Plan Enroll, all of your appointments, and of course, as up to date as it can be, but all of your appointments are available on your Plan Enroll Pearl, your personalized URL. So if you're up to date on your appointments, you've done your attestations, you're certified with all your carriers, Plan Enroll has a Pearl for you where you can send your clients to, and ultimately, but Plan Enroll basically enables you to have a Pearl for all of your carriers. That's so useful, because if you can automate a funnel of clients over to your Pearl, you can expedite the time between providing service and providing that first conversation. That's tremendous. So the one thing I do want to focus on, Tony, because you mentioned those silver sneaker leads, I do want to emphasize the leads in Lead Center and that overall opportunity as a whole. And Tony, you might, you were rolling out the red carpet. You can go ahead and take that walk. You want to talk about the Silver Sneakers program?
No, I'll give it to you. You can go ahead.
So the Silver Sneakers program, if you've been in the business long enough, you probably know that those seniors that are looking to improve their health are looking for gyms and fitness clubs and things of that nature. Well, Plan and Roll actually partnered with Silver Sneakers to create a lead campaign exclusively for Integrity, our agents, and our downlines, guys like you. So you can basically connect with seniors who are looking to improve their health at a facility that participates in Silver Sneakers. This lead campaign is extremely, extremely valuable. And I cannot stress this enough, how simple it is to connect you with these people. Basically, they're filling out a survey and submitting their information to you, and then you connect with them. Are you kidding me? That's crazy. This is like the dream lead. I know, Tony, we all have our own philosophies on how leads work and how to use them and this and that, but this is closing higher than any other lead we've seen. What? I mean, that is insanely useful. I simply cannot stress this enough, how tremendously useful this is in terms of your business. Ultimately, these leads are coming right to your Plan and Roll and your Lead Center platform. So if you're using the platform, you can engage in a live campaign. That's insane. These people are basically in a gym right now. They submit their information to the form. That form goes to your lead center and you connect with them. That could be a same day lead, not just like a Facebook live transfer, right? Like not just a call that comes to you because someone wanted information. Honestly, it's across the country available. So if you're in the Midwest, you're in the Northeast, you're down South, wherever, these leads are becoming more abundant as time goes on. There's marketing and advertisements tied to it as well. So it's like a great, great lead generation form. And when you get on the phone with these people, they're interested in what you have to say. It's just a great, great platform. Now, having said that, I'm going to shift away from this particular lead and lead platform. Lead Center as a whole, but the Lead Center platform altogether is gigantically useful. You can go into the lead inventory in real time and pull leads as it is. So if you need 100 leads today in your state, you can do that. And here's a live look. I pulled this, I think yesterday or this morning. So there are thousands of leads across the country based on the, if you need help with leads, we're available here. And Lead Center only gets better, right? So the idea here is if you need leads in your zip code, in your state, in your market, if you need leads in 6 months from now, the lead campaigns that Integrity is providing us is abundant. And I can't stress this enough. No matter how good you are, it really doesn't matter if you have no one to talk to. So these sales leads with Integrity are multi-products. So it's Medicare, it's life, it's both sides. Honestly, guys, if you need help, please let us know in regards to leads and contacts. I do have a brief video, but this will explain a little further on these platforms.
Introducing Ask Integrity AI, the first in the industry AI-powered digital assistant for agents. Ask Integrity combines data analysis with powerful intelligence to deliver important details about your clients. It's easily accessed through Medicare Center and the mobile app. It provides client information summaries, call summaries, and in-the-moment AI prompts like specialist recommendations. And all your client data is stored securely. Discover what Ask Integrity can do for you and your business.
So that's the AI, obviously Ask Integrity. A little summary there. Cool. I do have like a 5-minute video that dives a little deeper on the platform. If you'd like, I can send that to you. But this one just highlights the functionality and ultimately how useful it can be in your pocket. So all your leads, all your client notes, your whole CRM, it's basically got an app and it's free. As long as you're with an Integrity partner like Global, it's available to you immediately. Tony, with that, I'm going to pass the mic over to you.
Asked if there's no cost to join Integrity. There's no cost for any of these platforms or services. And just to let you know about the Silver Sneaker Lead, we learned this morning they dropped that lead down to $5 a piece. These are pre-qualified for you right from the gym. So the gym that the members are part of the Silver Sneaker program, it's really creative in what they're doing with that. And it's awesome where it asks them what type of plan they want, who they're, what they're currently utilizing. their current needs and preferences. Some people want dental. Some people want extra help with prescriptions. All that's in the survey lead that is produced through Silver Sneakers and Plan Enroll. And it even asks them at the end, would you like to speak to a live agent? And they have an opportunity to do that. It's pretty cool. If you can't sell the Silver Sneaker lead that we have, you probably shouldn't be in the industry of sales. So good stuff, Michael. Let's go ahead and go to the final close. I know we're getting close to the top of the hour. So our value proposition, a lot of people ask, Tony, what makes you different than other integrity partners? For one, you're going to have a hands-on relationship with us. I'm involved in 99% of the meetings. I make my personal cell phone available for those that need help. But some of the key things, we vest everyone day one. A lot of other IMOs and organizations out there, even some of them in integrity, don't have day one vested. That means, if you work with that organization, you write business, that book of business stays with the house. With our setup, you own your book of business for life. So day one, if you decide to move on 6 months, a year from now, or 10 years from now, you own that book of business. There's no vesting. I know there's some other organizations out there have a 10-year vesting, 5-year or 2 years. Ours is day one. That right there alone. I mean, that's why you work, in this business we want to help our clients and make a difference. That's what we're here for. God put us in this position to do as such. But also you're here to take care of your family. We have significant amount of agents out there that have been over retire in 4 to 5 years off their book of business. And there's even opportunities for you even to sell that to our organization. If you just, something happens, it does happen. We have agents that come down with some type of traumatic illness or an accident, and they have, only months to live. You're able to sell that book as well. We have lifetime renewals for the life of the book of business. So, and you guys have been in this business as long as I have. It's a very, very lucrative part of our business. Being paid on clients you served 5, 10, and 20 years ago. Lifetime renewals with every one of our carriers. There's also co-op opportunities available through our organization, Integrity, and carriers. Very lucrative. Just like you heard today from Essence, we're doing some creative things with them that other organizations don't have. And on a private call, I'll be glad to share that with you with top contracts. And I want to stress to this, we should have said this earlier with Essence on the call, Michael, but they actually have double the overrides for the traditional companies out there. For example, a GA that normally gets about a $50 override, it's a $100 override with Essence. MGAs are up to, I think, $250. It's pretty incredible overrides to help you build your business along with co-op dollars. Like I said, I'll share that with you guys that are interested. I'm going to get my number out at the end. If you're interested in a GA or MGA, SGA contract, or even an FMO contract, give me a call. I'll help you with that. We have a virtual library of every type of topic you'd like to discuss, from helping veterans, using the extra help program, what SPAPs are. We have in-depth training with national experts on that subject. We have a national platform as well. If you want to build an agency, it's something we specialize in. We build, hundreds of agencies across the country. If you want to be an agency of 50, we can help you with that. If you want to grow to an agency of thousands, we can help you with that as well. So we have a platform that will help you access working with agents, how to touch those agents through social media, email blasts, other digital platforms to help them understand who you are as an agency director and how they can join your team. And we even have, for new people out there that want to get licensed, we have a national platform to help you do your certification as licensed through an enterprise training school who we're also partners with as well. Next slide, Michael. So our current GPP campaigns, what I'm excited about, which helps the agents direct during annual enrollment period, which we're in now, you can get additional support for the agency directors, sitting from $25 to $100 marketing co-op pair enrollment. And for agents, direct to the agents, we're doing a $100 marketing co-op with specific carriers in your marketplace. It's really, really huge. And also, we incentivize those that want to recruit. You may not want to manage them, but even if you do, for every recruit you bring into our organization and do at least 10 applications, you get a $1,000 recruiting bonus for bringing them to our team, because we're always looking for good quality people that have the right attitude. They're doing this with a spirit of servitude to the community. They want to make a difference. They have strong work ethic and are good people, have good sales skills. good people skills, we want to meet them, and we're going to incentivize you for that. Now, some people ask me, if I manage them, do I still get the override? Yes, you get the $1,000 bonus, plus you get the override too. Pretty cool stuff. And there's no cap on that. So if you bring in 50 people, that's $50,000 additional recruiting bonuses. Pretty cool stuff. And also top producer incentives. So we have a platinum club. We have a chairman's club. We do a leadership summit. This year we're going to Punta Cana. Pretty cool stuff that we get together and collaborate from all industries. By the way, we have guys that are top in insurance, life insurance, final expense, pre-need, Medicare, ancillary. We get together and collaborate, and we do this amazing roundtable meeting and discuss what's hot and what's not, what's working for them, creative marketing tools, IT tools, and it really gets us better. It's like you get 50 people in a room, you come in with one idea, you walk away with not only you got your idea, you just picked up 49 more. It's pretty incredible stuff. Wanted to share that. Next slide, Michael. I know we're running low on time, brother. So, Michael, I'll throw it back to you, my friend.
Sure. We actually, ironically, we just tackled this at the end of the Essence segment in the first half, but people always ask how to get started, how to get contracted. I'll send you a link today with the Essence first look and a link to get contracted a little more on Global. Now, how do you find out more about working with us? We're actually going to give you our contact information on the next page. And then local support, we've got leaders all over the country that are willing to help and train you and get you up to speed on all things global and make sure that you have a solid business plan moving forward. Now, that said, my name is Mike. I'm the head of recruiting here. My number is 443-478-2853. You can call or text anytime. My email is mkaplan, so my name, at globalpremierbenefits.com. And I'll give you a moment here if you want to screenshot that. And you can reach out to me later. But I'm also going to email you all, as I said, the information so you'll have my contact there. And then Tony as well. His contact information is 443-253-3634. That's his cell phone. You can call or text anytime. He's a big texter. It's a lot easier. And then also T. Holland, so his name, at globalpremierbenefits.com. I'll give you a moment here if you'd like to screenshot that as well. And before we close, are there any other questions, concerns, feedback, anything of that nature before we wrap up? Been an awesome chat line, very active. I appreciate that.
Yeah, Mike, I just want to thank all you guys for being here today, and I appreciate the people at Essence. Really excited about what they're doing, and it's kind of like it reminds me when some of the carriers came out back in the early days when I was a life insurance agent, and they started coming out of the gate, and those that got in first really made out big, especially those that built large agencies. This is that opportunity that that many of my friends that are IMOs got started with United back 20 years ago. We're have that opportunity now with a company like Essence. So it's kind of a ground floor opportunity. It's their first year. They're opening their doors up after 20 years of being a captive shop. Now they're opening it up to brokers like us. It's a tremendous product. I love startup companies, but this isn't a startup company, but it has that feel to it to me. It's not going to have all the challenges that the typical startup companies I've been with in this business. There's a lot of challenges, with their tech and their data, their reporting, network. This company doesn't have that. They've already had a 20-year presence, 5-star rating, already 65,000 clients on the books. They're doing things the right way. And their overrides for those that want to build a team I've never seen anything like it. It blows me away what they have to offer. So I'm looking forward to speak to you guys directly. You guys got my number. But I appreciate you guys for being there. Michael, great job today again. Appreciate the feedback and the positive, constructive stuff that we talked about today. It's really a special meeting. And as we say in part of all of our meetings, we never forget why we're here. I said it earlier, it's about changing and saving people's lives. There's a lot of good people out there that need help. And it's shocking to me how many people are still on original Medicare, or people that are in a sub plan that they can no longer afford, or they're in a group plan that they're being kicked out for whatever reason. We're in there to jump in and do a greater good. It's like 56 million people are going to choose a plan this year, whether stay in the plan they're in, or make a move into a Medicare Advantage from a Med Sup. There's a lot of activity. And I've seen this be based on our numbers. We had a record October since we've been doing Medicare. I have no doubt we're going to have a record November. This is going to be one of the best, or probably the best AEP of all time. So at Global, we're all about changing and saving people's lives, and we want to continue to provide people much richer benefits and ultimately saving them money. And that's what I love about the product that we saw today with Essence Health. It really is going to do what we're here to do. And I really appreciate you guys. May God continue to bless you always. Look forward to talking to you guys. Hope to meeting some of you guys very, very soon. God bless you all. Have a great rest of your week. Be blessed. Thank you.